What if someone you love has been showing subtle but concerning changes over the past year? It's easy to think that death in old age happens suddenly, but the truth is, the body often sends quiet signals months, even a year before the end. The problem is, these early signs are easy to miss because they seem small at first. It's only later, when looking back, that families realize the clues were there all along. But by then, it's too late to prepare or create those final, meaningful memories. In this video, we're going to talk about 5 key signs that often appear a year before an elderly person passes away. Some of these might seem like normal aging, while others may seem minor but actually point to the body's slow decline. Spotting these signs early gives you the chance to provide better care, cherish meaningful moments, and ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because understanding these 5 signs will help you prepare both emotionally and practically. You won't be caught off guard, and you'll be able to make the most of the time you have left with those you love. Let's dive in. Number 1. Noticeable weight loss. One of the earliest signs that someone may be nearing the last year of their life is unintentional weight loss. At first, it might seem minor. Maybe their belt needs tightening, their clothes look looser, or they're eating less than usual. Families often assume it's just part of aging, but losing weight without trying is usually a sign that something more serious is going on. This happens because the body may no longer be absorbing nutrients properly, muscle mass is shrinking, and key systems are slowing down. While some muscle loss is normal with age, losing it quickly can signal deeper issues. The body might be struggling to digest food, or it may not be processing protein well, leading to muscle weakness. This loss of strength doesn't just make it harder to move. It also increases the risk of falls, weakens the immune system, and makes the person more vulnerable to infections. A big reason for this weight loss is changes in appetite. Many elderly people stop feeling hungry like they used to. Food doesn't taste the same, meals don't seem enjoyable, and they might start eating much smaller portions or skipping meals altogether. This isn't just a choice. It's the body signaling that it's slowly shutting down and no longer needs as much food. This leads to lower energy, reduced strength, and an overall decline in health. In some cases, underlying health issues may also be causing the weight loss. Chronic conditions like cancer, heart failure, or kidney disease can cause weight loss long before more obvious symptoms show up. Even depression or memory problems can make someone eat less, starting a downward spiral where the body isn't getting enough fuel to keep going. Some families try to help by offering favorite foods or adding protein shakes to meals. But if the weight keeps dropping despite these efforts, it's important to understand that the issue goes beyond diet. It's the body's way of preparing for a deeper transition. At this stage, forcing large meals usually won't help. Instead, focus on providing easy-to-eat foods, keeping them hydrated, and prioritizing comfort over calories. If you notice a loved one losing a lot of weight, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay close attention. This isn't just about how they look. It's a message from the body. Recognizing this sign early gives you a chance to prepare for what's ahead with compassion, understanding, and the ability to make the most of the time you have left together. Number 2. Severe tiredness and weakness. One of the clearest signs in the final year of life is extreme tiredness that doesn't go away even after rest. This isn't just feeling a bit worn out. It's a deep exhaustion that makes everyday tasks feel almost impossible. Simple things like getting out of bed, walking across the room, or cooking a meal can suddenly take a lot more effort. Even holding a conversation might leave them feeling drained. This level of fatigue isn't just part of normal aging. It's a sign that the body is running low on energy and trying to conserve what's left. As organs start to slow down, the heart pumps less efficiently, circulation weakens, and the muscles don't get as much oxygen. This leaves the person feeling weaker, more unsteady, and less able to stay active. Another reason for this fatigue is that the body's metabolism is slowing down. Normally, the body makes and uses energy to keep us going, but as it starts preparing for its final stage, it redirects that energy toward basic survival rather than movement or activity. This is why many elderly people start sleeping more, taking longer naps during the day, and feeling tired even after short bursts of activity. Sometimes they may seem fine one minute and completely out of energy the next. What makes this even harder is the emotional toll. Someone who used to be independent might feel sad, frustrated, or embarrassed about not being able to do things they once managed easily. They may start avoiding social activities, hobbies, or even conversations, not because they don't care, but because they simply don't have the energy. Unfortunately, this can lead to isolation, where they stop trying, which can make the decline happen even faster. For families, it can be difficult to watch a once active loved one become tired and withdrawn. It might be tempting to encourage them to push through it, but that often doesn't help. Instead, what's most important is to understand their limits, give them the rest they need, and focus on making their days as comfortable and peaceful as possible. If your loved one is experiencing this deep, ongoing fatigue that isn't relieved by sleep, it's a sign that their body is undergoing big changes. This is the time to slow down with them. Listen, talk, and create peaceful moments together. What matters most now isn't how much they can do, but how much they feel loved, supported, and understood. If you're still here and finding these insights helpful, please comment number 2 below to let me know. And if you haven't already, hit subscribe and turn on the bell so you won't miss future videos. Your support helps us keep making content to inform and inspire you. Let's move on to the next sign. Number 3, more confusion and withdrawal. As someone nears the final stage of life, one noticeable change is how they think, communicate, and interact with others. A person who was once alert and involved might start forgetting things more often, lose track of conversations, or seem confused in familiar places. They may repeat themselves, forget names, or struggle to keep track of time, even if they never had memory problems before. These mental changes can show up months or even a year before the end. This isn't normal forgetfulness. It happens because the brain isn't getting enough oxygen and nutrients as blood circulation weakens. As a result, their thinking slows down. You might notice that they get confused more easily, have trouble making decisions, or sometimes don't recognize people or places they've known for years. Some may have brief moments where they seem clear-minded, only to slip back into confusion soon after, almost like their mind is fading in and out. Another common sign is emotional withdrawal. Many people lose interest in socializing as they approach the end of life. You may notice them speaking less, avoiding conversations, or spending more time sitting quietly in their own world. It's not that they don't care, it's that their brain can no longer process emotions and interactions the same way. Conversations might feel exhausting, and noisy environments may become overwhelming, causing them to pull back. You may also see changes in their mood or behavior. Some become more irritable, anxious, or easily frustrated, while others grow unusually calm, detached, or indifferent. This isn't just a personality shift. It's often a result of the brain adjusting as the body declines. As cognitive function slows, emotions become harder to express, and they may stop reacting to things in the way they once did. For families, this stage can be heartbreaking. Watching a loved one become confused or distant can feel like losing them before they're actually gone. But it's important to remember that they aren't doing this on purpose. It's something beyond their control. Instead of trying to pull them back into long conversations, meet them where they are. Speak gently, offer comfort, and let them know you're there. Even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or withdrawn, don't ignore it. These are often signs that their body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and focus on creating a space that feels safe, peaceful, and familiar. Even when their words fade, your love and comfort will still reach them. Let's continue to the next sign. Number 4, frequent illness and slow recovery. As the body starts to slow down, one clear sign is a weaker immune system. You may notice that someone who rarely got sick now seems to catch every cold, flu, or minor infection that's going around. Even small cuts, bruises, or scrapes take much longer to heal than before. This happens because the body is losing its ability to protect and repair itself like it used to. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even mouth infections become more common as the immune system weakens. Many families think these are just random illnesses, but when they keep happening or take a long time to clear up, it's often a sign that the body is struggling to fight back. Even antibiotics, which once worked quickly, may not be as effective anymore. It might take longer treatments, stronger medications, or several rounds of care to get over what used to be minor infections. This is because as blood flow slows down and organs weaken, the body can't respond to treatment as well. Another issue to watch for is slow healing wounds. If small scratches, sores, or bruises aren't healing properly or keep reopening, it may mean that circulation is poor. When blood isn't carrying enough oxygen and nutrients to the skin, the healing process slows down. For someone who isn't very mobile, pressure sores become a serious concern and can lead to dangerous infections if not carefully managed. One tricky part is that infections in older adults don't always show typical symptoms like a high fever. Instead, they may seem more tired than usual, confused, or uninterested in eating. In fact, sudden mental confusion is often the first warning sign of an infection in elderly people, even before other symptoms appear. That's why noticing these changes early can make a difference in providing comfort and care during this stage of life. For families, seeing a loved one deal with repeated illnesses can be heartbreaking. It's tempting to push for aggressive treatments, hoping that another round of antibiotics or one more hospital visit will fix the problem. But at a certain point, the focus may need to shift from curing to providing comfort. Simple things like keeping them hydrated, gently moisturizing their skin, and reducing physical stress can sometimes improve their well-being more than another round of treatment that may only add to their discomfort. If you've stayed with me and found this information helpful, please comment number 4 below to let me know. And if you haven't already, hit subscribe and turn on the bell so you won't miss future videos. Your support helps us keep sharing content that informs and supports you. Now let's move on to the next sign. Number 5, big changes in breathing and blood flow. One clear sign that someone may be nearing the end of life is a change in how they breathe and how blood circulates in their body. You might notice that your loved one's breathing becomes slower or shallower than usual. Sometimes they may pause between breaths, or their breathing might speed up and slow down without warning. A common breathing pattern at this stage is called Cheney-Stokes breathing. It's when a person's breathing alternates between deep, fast breaths and long pauses. These changes may be subtle at first, but over time, they tend to become more noticeable. Weakened blood circulation is another key sign. You may feel that their hands, feet, nose, or ears are cold to the touch. Their skin might look pale, bluish, or patchy, especially around the fingers and toes. This happens because the body is sending blood to the most vital organs, reducing blood flow to the rest of the body. It's a sign that the heart isn't pumping as strongly as it once did. Shortness of breath is also common. Even small movements, like sitting up, talking, or changing position, might leave them feeling out of breath. You may notice them breathing through their mouth more often or needing to stop mid-sentence to catch their breath. If they were once able to walk across the room easily, but now struggle with it, it could mean their lungs aren't working as well. Sometimes fluid can build up in the lungs, making it harder to breathe. This may cause a cough, gurgling sounds, or a tight feeling in the chest. While it might seem like they just have congestion from a cold, it's often a sign of the lungs weakening in elderly people near the end of life. You might also notice that they don't feel comfortable lying flat and prefer to sleep propped up on pillows or in a recliner to make breathing easier. For family members, seeing these changes can be scary. It's natural to want to help by encouraging deep breaths or worrying that something serious is happening. But often these changes are just the body's natural way of slowing down. While these symptoms can't always be reversed, there are ways to make your loved one more comfortable. Keeping the room cool using a humidifier or offering small sips of water can help ease their breathing. Sometimes medications or oxygen therapy may provide some relief, but the focus shifts from fixing the issue to keeping them comfortable. If you notice changes like slower breathing, cold hands and feet, or a bluish tint to their skin, pay close attention. These signs usually mean that the body is conserving energy and slowing down. This is a time to be present, offer comfort, and create a peaceful, calming environment where they feel safe. In these final weeks or months, the most meaningful thing you can give isn't medical treatment, it's love, dignity, and the reassurance that they are not alone. Final thoughts. As we wrap up, let's take a moment to reflect on the key points we covered: sudden weight loss, extreme tiredness, memory issues, frequent infections, and changes in breathing and blood flow. These 5 signs often show up in the final year of an elderly person's life. They may not all appear at the same time, and they might be easy to overlook at first, but when they do show up, it's the body's way of signaling that it's preparing for its final phase. For families, noticing these changes can be tough. It's natural to want to fight them, maybe by encouraging your loved one to eat more, stay active, or push past the tiredness. But sometimes the kindest thing you can do is listen to what their body's telling you and accept the process. Instead of focusing on reversing what's happening, try to focus on making their remaining time peaceful, comfortable, and meaningful. Recognizing these signs doesn't mean fearing death. It means being prepared for it. When you understand what's happening early on, you can give better care, make important choices ahead of time, and ensure that your loved one's final months are filled with love, dignity, and calm. This is a time to treasure moments, share memories, and remind them how much they are loved. If you're noticing these changes in someone close to you, take a deep breath and remember, you are not alone. Many families have been through this, and while it's never easy, knowing what to expect can give you strength, patience, and peace. Thank you for spending time with us today. We'd love to hear your thoughts. Please leave a comment below and share one thing you learned and how you plan to use it in your life. Your feedback means a lot to us and helps keep us motivated to create helpful content. If you found this video useful, please like, subscribe, and share it with others. Your support helps us keep making content that can inform and inspire people just like you. Thanks for watching, and we'll see you in the next video.